All right, so thank you for now. Right, Korea's transition into an Omicron-tailored strategy has ushered in changes on its testing, tracing and treatment fronts. For more, Choi Min-jung joins me now. Min-jung, welcome back.
Thank you for having me, Sunny.
Right, then let's start with a reminder about the changes in the treatment protocol for COVID-19 patients at home, Min-jung.
Right, Sunny. Amid the spread of Omicron, around 90% of the new patients are either asymptomatic or reporting mild symptoms. That being the case, the majority of them are recovering from home. As we reported earlier, there have been divided into two groups, an intensive management group and a regular management group. While people over 60 and those in their 50s who are at high risk or taking COVID-19 pills will continue to be monitored by healthcare workers, the rest will have to look after themselves. They won't be subject to regular monitoring, but they can access telemedicine services by calling a local hospital or clinic if their condition worsens. Around 145 home treatment support centers will operate 24-hour hotlines, and over 1,800 medical centers will provide virtual treatment and prescriptions for those in the regular management group, and close to 400 will look after those at higher risk. The Korea Medical Association said Wednesday that the country is capable of supporting more than 180,000 people recovering from home. But as of Thursday, the number of people in home treatment already topped 170,000, highlighting the need for an expansion in our medical capacity.
Right, I see, Min-jung. Meanwhile, on the vaccination front, Novavax vaccines have been rolled out, I hear. Tell us more.
Well, Sunny, the first batch of Novavax's COVID-19 vaccines became available in the country on Wednesday. 292,000 doses were released, and the country is expecting a total of 2 million doses to be distributed this month. And this is part of the 40 million doses the country is planning to provide in total. The vaccine is being produced by local firm SK Bioscience and is the third to be manufactured and distributed in Korea after AstraZeneca and Moderna's vaccine. But it is the first protein subunit vaccine to be manufactured in the country. It uses a more conventional vaccine format that is also used in hepatitis B and cervical cancer vaccines. So watchers say there are fewer concerns about side effects. Officials also said it is relatively easier to distribute the vaccine even abroad if necessary, as it can be stored between 2 to 8 degrees Celsius. The vaccine is set to be administered to those over 18 years old who have yet to be vaccinated, and people who can't get their booster shot due to side effects from the first 2 doses are also eligible. Authorities are set to announce details on its inoculation plans sometime on this Thursday.
Right, so back on the treatment front, Min-jung, I hear COVID-19 patients can be treated at regular wards in the case of an overload at the hospital. Do explain this for us.
Sunny, authorities on Wednesday said hospitals can assign COVID-19 patients to regular wards when there are more than 50,000 daily cases. If hospitals run out of negative pressure rooms due to a surge in serious cases, they will be allowed to treat patients in regular wards with partitions and other protective barriers in place. Officials said doctors may also consider treating non-COVID patients virtually, for instance through phone or video calls. Medical workers who are infected may even be allowed to come to work as long as they wear a mask and go through a brief isolation period.
Right, which in itself, Min-jung, is a very clear indication of the changing strategy here in the country. Now, I believe authorities are also taking a hands-off approach with regard to contact tracing. Tell us more.
That's right, Sunny. The QR code check-in system could disappear as part of this change. Currently, everyone has to scan their QR code or write down their personal information when entering public venues. This data was used to keep track of the movement of COVID-19 patients, but the government says the importance of contact tracing has faded as the focus of its containment strategy has shifted more towards high-risk patients and cohabitants of the infected. Earlier, the government also implemented a self-reporting system where COVID-19 patients fill out a survey on their own instead of being questioned by healthcare workers. Meanwhile, on the treatment front, the age requirement for COVID-19 pills could be further lowered to people in their 40s who are at high risk. Earlier this month, officials had lowered the age limit to 50.
Right. Min-jung, thank you for that coverage. I'll see you on Friday.
Thank you.